So May is here, and in the maternal and child health space, May is the Preeclampsia Awareness Month. So what is preeclampsia? This is a condition that results in raised blood pressures during pregnancy. Commonly, or this increased blood pressure starts from 5 months, 20 weeks, until up to about 6 weeks after childbirth. And this pressure can be raised with proteins in the urine. Or this pressure could be raised with damage to other various organs in the body. How can you know you could be having preeclampsia? One, of course, is your blood pressure could be high. So when you go for antenatal, your doctors will tell you that you have a high blood pressure. But number two are the symptoms. You could present with things like a headache. You could have visual challenges where you see double vision or spots. Or you could also present with chest pain and swelling of the body. And in other cases, you would have difficulty in breathing and cough and even reduced output of urine. What causes preeclampsia? The exact cause is not known, but what we do know is that poor placentation is responsible for preeclampsia among pregnant women. And what that means is that the placenta that forms from the baby has not attached itself properly on the wall of the womb. And that will result into the baby getting less food and less oxygen. And that is what we call placental ischemia. So if that occurs, the placenta releases chemicals into the blood circulation. These chemicals damage the blood vessels and cause the mother's body to respond by triggering a response resulting into an increase in the blood pressure. So if you do have raised blood pressures during pregnancy, our emphasis is make sure that you go to hospital. Make sure that your doctors have seen you and you have seen an obstetrician and a gynecologist. Because once that has been confirmed, then we need to intervene. The interventions of the doctors can range from controlling your blood pressures and making sure that your pregnancy can at least push on until the baby is mature, or it could also involve controlling the complications that come with high blood pressures, preventing things like stroke and convulsions, or it could actually result into termination of the pregnancy, especially if the blood pressures are not controlled. So if the pressures are not controlled, despite every intervention, your doctors are going to suggest and propose for that pregnancy to be stopped. So make sure that you have a discussion with your doctor and you've understood. And most times we want you to take the medications, the pressure medications. We'll give you review visits if we think the pressure is not that bad. But if you're having severe features, then you're likely to be admitted and interventions started upon. How can you prevent this? Well, primarily, the prevention would be to not to get pregnant, which of course is not reliable. But we can determine if you've had risk factors. So maybe for people who are at risk or people who are at risk of getting preeclampsia, such as first-time mothers, women who are having newer partners, women who are carrying multiple pregnancies, very young mothers, less than 18, older mothers above 35 to 40 years of age, mothers who have conceived via IVF, mothers who have had previous family members with preeclampsia, like their mothers, their sisters, their grandmothers, women who have had immune diseases such as lupus. All these are women in the category of the high risk category. So such mothers always benefit from preventive interventions such as aspirin. So far, cardiac aspirin at a dose of 150 milligrams has been shown to be effective in controlling recurrence of preeclampsia in the next or in the subsequent pregnancies. So be on the lookout. As a pregnant mother, make sure that your pressures are measured each time. And if you see any of the symptoms we've spoken about, please seek medical advice. Thank you, and catch you on the next one. Don't forget to like, to subscribe, and to share this with every pregnant mother and woman out there. Thank you. Thank you once again.